Tonight, on the Doctor's Lounge, we take an in-depth look into health problems faced by average middle-aged women in our society. This is Mary. We'll be taking a close look into Mary's life and investigating her problems with her health and how to manage them.
I can't sleep.
Mary's lifestyle and medications could be the cause of her insomnia. She's experienced an increase in her stress levels since she has started work on her new job and with the domestic arrangements of her son. According to Katie from the National Sleep Foundation, this stress would be causing Mary difficulty in falling asleep. As for Mary's medications, according to OzDI, there is indication that beclomethasone would be causing rarer physiological behavioural effects. These include sleep disorders, anxiety, depression, aggressiveness, and neurological hyperactivity.
Mary is under a large amount of stress. This is a large risk factor for clinical depression. She has been prescribed the antidepressant fluoxetine. Mary has self-prescribed St. John's wort, which is advised to support healthy mood balance. Both medications that Mary has been taking increase her brain serotonin levels. The interaction of these two medications puts Mary at risk of developing a condition called serotonin syndrome. Australian prescribers report the condition may cause mental, autonomic, or neurological changes ranging in severity, mild to life-threatening. There are many other forms of treatment available for clinical depression, forms of psychotherapy that are used in depression. Exercise has also been recognised as a form of treatment. Blithemel, Smith, and Hoffman have found exercise may reduce the symptoms of depression by 7.3%. Clinical depression treatments must be tailored to patient preference and response. Therefore, Mary must continue to monitor her treatment with her GP.
Mary has been experienced a decreased appetite over the last month. Mary has lost 4 kilograms.
Mary has questioned if her weight loss is due to a possible cancer. She should be referred to a specialist to investigate the presence of any. There would be numerous causes as to Mary's weight loss and anorexia. As for her lifestyle, authors Folk and Folk have explained that the stress of her new job and the domestic arrangements would be causing her decreased appetite. High levels of cortisol would be being excreted and accumulating in her gastrointestinal system. Diabetes Australia emphasises that if these stress levels continue long-term, it could cause her to develop type 2 diabetes. Numerous authors have supported that Mary's stress levels, as well as smoking habit, would be causing her to have hypertension. As hypertension is a risk factor for numerous other problematic conditions, it would be appropriate for Mary to get a routine test to track her blood pressure.
She is currently taking numerous medications that would be altering her appetite and gastrointestinal function. The diclofenac tablets that she's taking 3 times a day have side effects of nausea, gastrointestinal bleeding, diarrhea, esophageal ulceration, and rectal irritation. Nausea and diarrhea and gastrointestinal upsets, such as stomach ulcers, cause weight loss. The fluoxetine she administers twice daily causes nausea, diarrhea, and weight gain or loss. Mary is a smoker. She smokes a pack a day.
Mary's inhalation of up to 25 cigarettes per day is a potential therapeutic problem as it significantly increases her risk of developing lung cancer. Cigarette smoke contains several carcinogens including nitrazine, benzene, formaldehyde, and arsenic. Such carcinogens may interfere with biological processes, inducing malignant division by altering cellular metabolism and or directly damaging the cell's DNA. Nicotine activates neurotransmitters including dopamine, NA, and 5-HT, which triggers appetite suppression. Subsequently, lung cancer may induce anorexia syndrome, characterized by an increased metabolic rate and a decrease in muscle and adipose tissue. Hence, diclofenac should go under review. When managing this potential problem, the first priority is to refer Mary to a specialist to obtain an official diagnosis. To reduce the effects of lung cancer, Mary should cease smoking and adhere to a healthier lifestyle and diet, whilst being supplied with the appropriate education from her healthcare team.
Mary is an asthmatic. She has been prescribed beclomethasone and salbutamol to manage her symptoms.
Mary has been experiencing pain in her joints.
The doctor has prescribed Mary with salbutamol MDI 100 micrograms with 2 puffs twice a day when required, and diclofenac 500 micrograms, 1 tablet 3 times per day. Her asthma will not improve if she continues to smoke 25 cigarettes per day. The diclofenac has been prescribed to Mary to manage her joint pain. The reason that hypokalemia has become a potential problem is that within Mary's situation, she is taking NSAIDs, and having too much of this drug within her body can lead to drug-induced hypokalemia. The second potential therapeutic problem that Mary may encounter is gastrointestinal ulcerations causing bleeding, caused by too much drinking of alcohol, regular use of NSAIDs, and smoking cigarettes. If Mary develops NSAID-induced ulcers. She must use the lowest possible dose to manage these ulcers, and also to decrease her smoking and drinking to help manage this potential problem.
Mary's arthritic pain has been caused by early stage development of osteoporosis. Her risk factors include possible menopause, smoking, low body weight, low physical activity, and a poor diet. Mary is also under the use of the corticosteroid beclomethasone, which may be attributing to Mary's arthritic pain in conjunction with the other associated risk factors. AMH states that the major adverse effect of beclomethasone is it can decrease bone minerals and density if used at high dosages for long periods. Possible treatment options include lowering or intermittent dosing of the beclomethasone, or referring Mary to her GP specialist for review of the beclomethasone to a more efficient medication alternative. These medications include fluticasone and bethnodecinide. Therapies that Mary can use are regular weight-bearing exercises and a balanced diet to increase her body weight. Cessation of smoking, which will increase vitamin D absorption in her gastrointestinal system. This increases calcium vitamin affinity in the small intestine. And the continuation of the non-steroidal anti-inflammatory drugs at a lower or different dosage to reduce interaction. This will preserve bone mineral density and reduce soft tissue inflammation. Mary's diet and lifestyle should also have increased levels of calcium from low-fat dairy products and vitamin D from other sources such as fish and sunlight. It is also important to reduce the amount of alcoholic drinks she consumes, as these increase the risk of developing osteoporosis. So, it may be helpful for Mary to book an appointment with a dietitian for a diet plan and a physiotherapist to assess with low weight-bearing exercises that are suitable for her. By also introducing new emerging modifiable factors such as vitamin D, omega-3 fatty acids, and soy and other supplements, Mary can manage the progression of her osteoporosis and her arthritic pain.
If you are experiencing any of these relative signs and symptoms, please contact your GP or specialist for information or visit these websites.